money in.
Your history questions. So what do you do for a pastime?
Well, I'm a gymnast,
Okay.
so
Do you work or do you just go to school?
no, I just go to school.
Okay. Have you ever had any previous ankle injuries?
Yes, I've broken my ankle.
Okay. What type of shoes do you wear?
Vans or Converse or sandals.
What type of equipment do you tumble on or run on?
Usually like a springy floor.
Okay. What did you do to cause your injury?
I did a tumbling pass and I landed wrong.
Okay, so have your symptoms gotten worse or improved or just stayed the same since your injury?
They've stayed about the same.
Where does it hurt and how much pain are you in on a scale from 1 to 10?
It hurts right here, and I'd say it's about an 8 when I move my foot.
Are there any deformities
No.
on your ankle? Anything sticking out?
Nope.
Okay. Do you have any swelling or is it discolored at all?
It's a little discolored.
After your injury occurred, were you able to continue tumbling on your ankle?
No.
Okay, so here we're going to observe her anterior view, and we're going to make sure that her toes are in line with her tibia, and then we're going to turn medial, and then we're going to inspect to see if she has high arches or no arches, and we're going to see if there's any prominence on her middle foot. And then we're going to go to the lateral view, and we're going to look for any swelling or the prominence of the calcaneus. And posterior, we're going to see if she has the slight valgus in her ankle. Okay, now she's going to stand on her toes. There should be a slight varus alignment here. And now I'm going to have you stand. This is gait, just to make sure that she has equal stride length and her foot position and weight distribution are the same. And her feet should be within 1 and 20 degrees of external rotation when she's walking. So on the top of the foot, we're going to look at the toenails, and we're going to look for bunions, hammered toes, and claw toes, and the ability to spread your toes, and look for ulcers in there. Now dorsiflex, and we're going to look for plantar warts, calluses, and any ulcerations on the bottom of the foot. I'm going to be palpating for tenderness and swelling. So palpate the medial and lateral malleolus. And then I'm going to feel for the tibial nerve, see if that causes anything. And then I'm going to palpate the posterior heel. The peroneal tendons. The anterior ankle, so along the talar fibular ligament and the calcaneofibular ligament, and then the plantar fascia, and the sesamoid, so in between, and the MTP joints. For range of motion, we would use a goniometer to measure passive and active range of motion, and dorsiflex really fast. The dorsiflexion, the normal range is 0 to 15 and 20 degrees, and plantar flex. And the normal range of motion for plantar flexion is 0 to 40 or 50 degrees, then invert. The normal range of motion for inversion is 0 to 25 or 35 degrees. And eversion is anywhere from 0 to 20 or 25 degrees. Okay, so now we're moving on to muscle testing. And we're going to test her posterior tibialis. So, and try to invert. Okay. Now we're going to test her anterior tibialis. So try to invert and dorsiflex. Okay. And then her peroneus longus and brevis. So try to evert. Yeah. And then extensor hallucis longus and extensors. So to extend. And the flexor, hallucis longus, and flexors. So try to your big toe. Okay. And then gastrocnemius. So. Okay, so now we're going to do some special tests. And we're going to test for the anterior drawer test, which is going to test the tibiofibular ligament. And now the apprehension test. So we're going to evert it and see if it hurts. That hurts. Okay. The varus test, which is going to test the calcaneofibular ligament. And the valgus stress test, which is the deltoid ligaments. And the MTP instability. And the Morton's neuroma test.